Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then renal glucose transport inhibitors. So in the renal glucose transport inhibitors, we have different drugs. The drugs under renal glucose transport inhibitors, that is nothing but sodium glucose 2 inhibitors. These drugs include, we have empagliflozin, dapagliflozin, sergliflozin, remogliflozin, canagliflozin. So these are the sodium glucose 2 inhibitors. So these will inhibit the sodium glucose like transporter 2. So when these drugs inhibit the sodium glucose transporter SGLT2, if they inhibit the SGLT2, and thus this SGLT2 is normally required for reabsorption of glucose in the PCT. Normally SGLT2 causes reabsorption of glucose from the PCT, but because of the absence of this, the glucose is not absorbed, so thus glucose is not reabsorbed. If glucose is not reabsorbed, it will be excreted in the urine, so thus maintaining the blood sugar levels. So uses are, it can be used as an adjunct drug. It can be used as an adjunct drug for type 2 diabetes mellitus along with insulin. It can be used as adjunct drug for type 2 diabetes mellitus along with insulin for controlling blood sugar levels. Then the side effects of this SGLT2 inhibitors are, these SGLT2 inhibitors can result in weight loss of the patient. They can cause frequent, because here glucose is excreted in the urine, that is glucosuria is seen. So because of this glucose is excreted in the urine, this can result in genital infections, and it can also result in urinary tract infections. Sometimes it has a rare association with breast carcinoma, and also the bladder carcinoma is seen with these as SGLT2 inhibitors. It can also cause hyponatremia as the side effect. SGLT2s are these drugs are also associated with increased risk of fractures also.
thank you and thank you for watching.